Yeah, let's look at the coronavirus situation in Australia. Joining us live is Alisa Ventura. Hello, Alisa.
Hello, Alma.
Hello. Go ahead, Alisa.
Yep. We are bringing you the latest updates on the COVID-19 crisis in Australia. According to the Johns Hopkins University of Medicine, as of 6:40 p.m. of Australian Eastern Standard Time, today, 10th of August 2020, there has been 21,397 confirmed total cases of COVID-19 here in Australia, up by 313 new cases within the last 24 hours. Victoria holds the highest number of recorded cases at 14,957, followed by New South Wales at 3,875 and Queensland at 1,089 cases. Out of the confirmed Australian cases, 313 people have died from the disease. As of 9 p.m., August 9, 2020, there has been approximately 5 million tests conducted nationwide here in Australia, with 0.4% of the tests returned with a positive result. Here in Queensland, due to the increasing cases from neighbouring states, interstate border closures were implemented to maintain the rate of interstate acquired cases. A Queensland border declaration pass is required to be granted entrance to the state. Moreover, anyone who has been in a COVID-19 hotspots, which includes all of Victoria, New South Wales, and Australia Capital Territory, in the previous 14 days are not allowed to travel to the state by road. As of 1 a.m., August 8, 2020, Queensland border restrictions has tightened. This meant that those who can travel to Queensland are truck drivers, workers related to transport of freight and logistics, people performing essential activities in border zone residents. On a positive note, Alma, fever clinics and pop-up testing clinics are still up and running here in Queensland. Here in the city of Townsville, a new pop-up testing clinic was set up last Thursday on 6th of August 2020. Those who have felt any of the COVID-19 symptoms such as fever, cough, sore throat, shortness of breath, runny nose, fatigue, and loss of smell or taste, no matter how mild, are encouraged to get tested. That's all for Australia. Back to you, Alma.
Okay. Alisa, can you update us on the situation of our frontline workers over there in Australia? How are they and how are they coping?
Yep, they're doing really fine because fortunately here in northern Queensland, we're in a better situation with we don't have much cases so far. And regarding to facilities, they have also been implementing the social distancing rules. We have our chairs set apart, more hand hygiene stations, and also for patients that want to come in to get themselves checked, whoever got a flu-like symptoms such as cough, fever, flu, or cold are asked to stay in their cars, and the doctor will check them in their cars as well. And we also have our respiratory and our respiratory equipment, so such as like spirometry, the one that you use to test your lungs with, and some nebulizers and like oxygen masks have been sort of we have stopped using them because of to limit the amount of transmissions we can do, because of the COVID itself can be transmitted through droplets from the air that we breathe out.
What is the most challenging problem you've encountered? You are in the health industry, aren't you? And
Yes, Alma.
yes, go ahead. Can you tell us what's the most challenging thing that you've faced so far?
The most challenging thing that I've faced so far is that people, some of them are not aware that how serious the situation is. People will just sometimes walk in a desk and ask for directions, and then I'll just find out later on that they're gonna have to be tested for COVID, even though they might show up negative, but we still have to put some precautions on. That's why we have precautions on to limit the amount of cases that we will have in the future.
All right. Okay, thank you so much. You do take care. You stay safe and stay healthy, and looking forward for more updates from Australia. Thank you, Alyssa.
Thank you, Alma. This is Elisa Ventura from Townsville, Australia. We live in interesting times.